My name's Julie Leonard. I work for Market Vision Research. I'm Vice President of Healthcare Qualitative Insights there. The committee that I'm on for Entellus is the Clear Health Communication Task Force, otherwise known as Health Literacy. We changed the name a few years ago because health literacy kind of puts the onus on patients, on respondents, to be literate. And really, the onus is on us to communicate clearly. When you think about the work that we're doing, we're typically trying to help organizations communicate effectively with respondents. Generally, you can assume that physicians, other healthcare providers are going to be pretty health literate. We would hope so. But when you're talking to patients, caregivers, a lot of times the language that is used goes right over their heads. Typical vernacular for somebody that's used to speaking with physicians or physicians who are used to talking with other providers oftentimes is very different than what a person might understand just based on education level. But it also can vary with where they are in their lives. So as somebody gets older, they might start to have a visual impairment or a hearing impairment. That's going to affect how well they're understanding written or materials that are being explained. If you're under a lot of stress, you've just been through a natural disaster, or you've just gotten a terribly scary diagnosis, you are not going to have the same ability to take in medical information. So we're really advocating for educating people who are in the insights industry to understand how do you talk to patients and caregivers in a way that is going to be universally understood by everyone. We're on our second round of kind of health literacy training right now. We have one that's on the Entellus website that is sort of the basic principles of health literacy, why it matters, why it's important. This one that we're doing now, that will be the next one to be added to that library, is kind of a tool shed. So it's a number of different tools that you can use to evaluate your materials to see what's the education level we're looking at here. Is this at a level where the general public ought to be able to understand it? And a lot of the tools will highlight words and phrases for you that you need to change and give you suggestions for how to make that more accessible to a lot of people. One of our conference presentations was partnered with ZoomRx, and we had recordings of of discussions between patient and provider. And in some of those, they had a translator involved. And so some of it was just looking at what's understood through a translator. And we saw what the physician said, what the translator said in translation, then what the patient's questions were and how that got back. And it was interesting when physicians just talk, only the last little bit of what they said gets translated, because the translator has to remember all of that, translate it and relay it, right? So when you had them chunk it, so they would say a little bit, pause, wait for the translation, wait for questions, chunk another piece, it was much better understood. I talk in our training about the reasons that health literacy may impact somebody. And that's kind of an area of passion for me, is making sure that provider-patient communication is the best that it can be, because that affects outcomes. If you don't understand what you're supposed to be doing, you might not take your meds right, or you might not show up for whatever they wanted you to do, whatever that treatment may be. Or if you didn't understand the side effect conversation, you might stop taking your meds and now you're back in the hospital, or you don't have a good outcome. It's in the same way as clinical trials for such a long time were done on white men, because it's easy, because women have hormonal changes and different things happening that their bodies are more complicated, so we do what's easy. And then you start to find out that women's bodies respond differently, people of different ethnicities respond differently. It's important, and in this same way, it's important to be sure everybody's included in the communication.